Welcome, and thank you for joining us today. This is a question and answer session for January 15th. Public Health Director Annette Rodriguez and Dr. Chris Bird are addressing questions received this week. Please feel free to add your follow-up questions to chat. As you can see from the video, Director Rodriguez is actually on site at the vaccine distribution event. Can you tell us what's going on out there?
Well, we have tons of people here. So we told everybody we received 5,000 doses yesterday. 2,500 doses are going to be administered into people's arms today, and another 2,500, more or less. There's some extra doses in the vials, but for the total of 5,000 doses within the 2-day time period. So lots of traffic this morning, a lot of confusion. Part of it is just because the livestock show is going on. So we did have some trailers that we're trying to get in as well, but we're so glad that people are wanting the COVID-19 vaccine and that they're coming out to show us that they really, think that it's important to get the vaccine. So we really appreciate that.
Right, it's definitely important to get the vaccine so that we can get to herd immunity without everybody contracting COVID. We have some questions for you, Nat. We know you can't see the questions this week, so I'll read them out to you. Will the Public Health Department offer vaccinations at other locations within Corpus Christi, Flower Bluff, and Port Aransas? And essentially, what are the plans for additional sites in the future?
So the state asked us if we would be a hub, not just specific for Nueces County, and they wanted us to be somewhere that was easily accessible to many different areas because there is not a residency requirement. But yes, we are looking for different venues. We're vetting them now, not only the natatorium, but the malls, but also American Bank Center, the Greyhound Racetrack. There's a lot of different venues that would be really great for mass vaccination. We just have to find it. We have to find out what the cost is and, see, what all is involved in actually moving from one location to another. We have to set all of this up. And I don't know if you can see, but I mean, there's a lot that goes into it. There's people that are drawing up vaccines. There's the vaccinators, all the cars. And there's cars all the way out, all the way to the baseball stadium. So there's a lot that goes into setting it up. It's not like you just show up at somebody's location and it's ready to go. So, but yes, we are looking at other locations, within the city limits.
Right. It seems like managing traffic is one of the biggest issues there.
Definitely is.
Okay. Moving on to the next question. What are the plans for organizing the second vaccination dose rollout? How would the second dose clinics be held?
So when you come and get your first dose, we have a system called Luminaire, and that system actually is going to text you. We have your phone number. They're also going to email you. And so when you receive that message from them, you can actually register right there for the next event, the next drive-through event that we have. You can actually get your second dose as early as 4 days before the date, and the date's on your vaccination card. But you can actually even get it up to 28, 30 days after the date. And so it doesn't have to be on the exact date, and it doesn't even have to be here at our drive-thru. If you see H-E-B has Moderna and you receive Moderna from us, and that's all we've given out, you can get your second dose there. But we do have a process to alert you, and then you just, next time you see our drive-thru open, you come in and you can get your second dose at that time.
Okay, I think you answered this question, but some people are concerned about their provider not administering a second dose because they received their first dose somewhere else. Is that a thing? Is that going to be an issue for some people?
The state has told us that you can get your second dose anywhere you want to get your second dose as long as it's the same manufacturer. So if you originally got Moderna the first time, you have to get Moderna the second time. If you originally got Pfizer the first time, you have to get Pfizer the second time. But I can see those concerns. I think the best way to alleviate those concerns for your private provider is to have your vaccination card with you, showing proof that you received your first dose, and then I think they would be comfortable giving you that second dose. But if you just show up to them and say, I had it, I don't know that they would feel comfortable giving you the second dose.
Okay, so they don't have computer access to the system that lets them know what your first dose was?
Well, a lot of these providers, to be honest with you, they're new to the system. And so most of the providers that use the system are pediatricians because it's for the Texas vaccine for children. The system we're using is called MTRAC. And so they're not very comfortable yet. So if it's a provider for adults, they haven't really learned how to use the system. So I can understand them, questioning, how can I give you the second dose if I don't even know that you got the first dose or you didn't get it from me? So,
Okay, so it's important to keep that card and don't lose it if you want to get that
Absolutely.
second dose at your provider.
right.
Okay.
I have some of those cards. Let me see if I can grab one. I'll show it while you ask the next question.
Yeah, perfect. I was going to ask you to show a card, but then I decided I didn't want to put you on the spot. Okay, so the next question is, what have been the best lessons learned from hosting this mega vaccination clinic and administering thousands of initial vaccine doses?
So what was the question? What has been the best?
Have you learned any lessons from administering these mega vaccination clinics over the past week?
Oh, absolutely. I think that they work well. I think that you can move, thousands of doses very quickly. I've heard a lot of places that they're doing vaccinations every 10, 15 minutes, and that's great as well. But in order for us to if we're ever going to really try to get behind this pandemic, we need to be doing large numbers of people. So this is a really great avenue to do that in, a mass vaccination clinic like this. But I wanted to show the card real quick. So this is what the vaccination card looks like. And it basically says, here is your first dose, and today is the 15th. And then it tells you when your second dose is due. Your second dose is due on or after February the 12th, 2021. So it tells you all you have to do is put your name and your date of birth on it, and you keep that with you. And if you want to go somewhere else, or you're out of state and you're going back, to where you live, you can take this with you and you can get your second dose that way.
Perfect. Can you hold that closer to the camera just so we can get a good look at it? Closer?
Is that good?
Yeah, that's good. Thank you. Looks great. Okay.
You're welcome.
All right. So we have some additional questions. Let's see. On vaccines. If I get a vaccine, will I be able to donate convalescent plasma?
I don't think that you can, but again, I would ask, the Coastal Bend Blood Bank is very good with all of those responses, so I would definitely reach out to them, call them before you go out there. But no, I think you can't give convalescent plasma after you've done your vaccine.
Okay, thank you. And I guess this next question is for me, and actually I asked it of myself. But I thought it was important to address this. And it's how much closer are we to herd immunity with the vaccines? So this morning I went through the state's data, and it looks like approximately 2 to 3% of the Coastal Bend has been vaccinated at this point with one of the two, Moderna or Pfizer vaccines. And so to get to herd immunity, we're looking at needing 82% of the Coastal Bend having either been recovered from COVID-19 or vaccinated against it. So we've got quite a long ways to go, but I think we're definitely making a good dent in it this week with just our public health department distributing how many doses? Is it 9,000 doses this week?
That's correct, 9,000 this week.
Okay, and that's out of 600,000 people in the whole Coastal Bend. So that's a pretty decent dent, and if we can keep that going, and maybe even increase it. Sorry, Annette, but we want to have you guys administering even more. We might get up to like high percentages.
We're always looking for volunteers, so if you want to come out, Dr. Bird, and help us one day or 2 days or 7 days, that would even be better.
Perfect. I'd be happy to come out and help.
Thank you.
I'll bring my grad students along with me.
Oh, great! Even better. The more the merrier.
Okay, and then the last question that we have that's pre-planned, and again, I asked this question and because I think it's important for people to hear the answer. So we're reading a lot about new variants now because our awareness has been raised, and all of a sudden, scientists are looking for new variants of COVID, and we're hearing all about them. So we're hearing about UK, South Africa, Brazil, Japan, United States. Within the United States, Ohio is coming up recently. So the question is, what are we to make of all this? I think the important take-home message is that one, there might be a little bit of overexposure on the new variants right now. There are thousands of COVID variants out there. The important take-home message here is that it seems that through time, COVID is becoming more transmissive. And this isn't the first time that we've noticed this. Back in our summer outbreak, there was a new variant that was going around then that was slightly more transmissive. And through time, COVID is evolving. And so the take-home message here is that we're not out of the woods, and COVID's becoming more transmissive, and it's one of the reasons why we want to get everybody vaccinated as soon as we can. Right now, these new variants haven't out-evolved the vaccine, but it is possible, at least theoretically, if we let it go on long enough without vaccinating, that a large amount of infections could lead to them out-evolving the vaccines, and we don't want that to happen. So, take-home message, be vigilant, get vaccinated, and hopefully, I don't know, maybe by the end of the summer, we'll be in a lot better place than we are now.
I agree. Thank you for that.
Okay. Let's see. Tiffany, do we have some questions from our audience?
Yeah. So yesterday we had high case counts. Where do we think these are coming from?
They're coming from everywhere. I think what happens is that people, it seems like in the workplace, they're starting to get a little lax. And so, they're going to lunch again together. And so it's not one person or a family entity that's getting exposed. Now you have groups of people that they work close to. And so there's a lot more exposure. And so you have a lot more potential for those individuals to get the virus. And so you're seeing exponential growth. And that's what we didn't want to see. And that's what we told people when we're at 150 cases a day. We need to try to get to the hundreds and to the double digits, because it goes from 150 to 267 to 300. And so, the cases everywhere are going up. We've seen them nationally, and we really need to try to continue to use our public health strategies.
Yeah, I'll add on to that. In a recently published scientific report, they found that the workplace was one of the most common locations for people to contract COVID. So it's important that everybody, be especially vigilant in your workplace. Maybe that's one place that you let your guard down, but this is where a lot of people are contracting it. In terms of our models, the numbers we've been seeing aren't outside of the projections and the amount of variability that we see in the data. So at least for right now, I'm holding off on saying that we've entered a phase with a higher transmission rate than what we've been projecting. Right now, it's within the bounds of what we would expect with the 1.1 transmission rate that we reported on Monday.
So would that mean we're not seeing a surge right now, or this currently is us seeing another surge?
We've been in a surge.
The surge continues.
Yes.
So
I think brings a question that, if you don't mind, Tiffany, a question for Dr. Berg that everybody's asking me, the positivity rate. Where are we in positivity rate, and are we going to reach those 7 days very soon?
Okay, I understand what you're saying. So for the state has indicated or made a threshold for a high hospital load based upon what proportion of the patients are COVID positive. And so right now we're at about 12 or 13%, and this number changes day by day. We were at 16.5% earlier this week, but it's been below the 15% threshold through Wednesday. Now, the state hasn't updated its data for yesterday yet, and so I'm still waiting to see that. But what this means is that we won't expect businesses to roll back to 50% capacity until at least Thursday of next week, and that's the earliest that it could possibly happen because it takes 7 days above this threshold to trigger that rollback. Now, that being said, 81% of all of the trauma service areas in the state, and the Coastal Bend is a trauma service area, 81% of all of them are at 50% business capacity and have had this 15% threshold for more than 7 days. So we're one of the only places in the state that hasn't triggered this yet. But it looks like it's imminently going to happen. And at least last week, Jim Wells had already triggered it, right? So there was one county within the Coastal Bend that the state informed them that they should go to 50% occupancy and close their bars.
On that topic, we have a question saying, are we going to continue to allow the bars and restaurants to not comply with capacities and masks? What happened to checks?
Well, that's a great question, but TABC only has a certain amount of people that can get everywhere at one time. We are asking the bars to comply. They know they should be in compliance. They know that we can close them down. We've been working with as many bars as possible and still being able to, conduct the drive-throughs. We're only 160 people at the health district, and so we're being pulled in many different directions. But if you have a bar that's not complying, or a restaurant for that matter, please call our hotline, let our staff know, and we will send an inspector out, and I will personally call them to make sure that they get back into compliance. There's no way we're ever going to beat this if people are not wearing their mask and they're not complying with the rules. So thank you for that question.
How would we find that hotline number, Annette?
It's 826-7200. So you can look up the health department, Corpus Christi Health Department, 826-7200, option 2. That's our COVID hotline.
Okay, thank you.
Thank you.
You're welcome.
So I'm going to read this out. I'm an adult teacher. When will I be able to get the vaccine? Also, I currently have an iron deficiency anemia.
So if you're currently in the phase 1B and you're over the age of 65 or 65 or older, you don't have to have any comorbidities. You can come now and get your vaccine. If you're over the age of 18, if you're a teacher and you have at least one comorbidity, and just to be honest with you, a comorbidity could be an asthmatic. It could also be somebody with a high BMI, over 30. Any of these things are considered comorbidities. You can come and get vaccinated. We're hearing that 1C is going to be evaluated. The next phase is going to be 1C. It's going to be evaluated on Monday by Dr. Hellerstadt and the EVAP, the Evaluation Vaccine Allocation Panel, and they'll make a decision on who that group is, but we think it's going to be critical infrastructure, which includes our teachers.
Yep. Annette, is this a state level decision for opening it up to more phases?
It is, but they also said that that's not soon. That's not this week or next week. Right now, there's so much of the population is still in the 1B. We still have some 1As that haven't come through, but we're really pushing the 1B. But that portion of the population, we haven't received enough vaccine to really make a dent right now. But they're evaluating the definition for the 1C, and then that should be in maybe another month or two, and then that group will be ready to go.
Okay. So we have another question. When we see high cases, we assume hospitalizations will follow. Typically delayed, but they happen. How are our hospitalizations looking as of now?
And that's another good question. Oh, go ahead.
Have we reached that 15% threshold, which you answered? But okay. Go ahead, Annette. Sorry.
Okay, so when you have cases and they're increasing, a lot of the cases do not become very ill and they don't all get hospitalized. But we do know that there is a percentage that they will become very ill and they will become hospitalized. So I want to make sure that the community knows that. Some people will recover on their own and they'll be fine. We see that especially true in the younger population. But yes, it does make the hospitals or, the healthcare structure is being stretched right now. We continue to say that. COVID-19 cases, hospitalizations, and ICU patients continues to increase. And so we need to be mindful of that. And that's why we should all be taking the precautions we've been talking about to help to keep. The only way to keep those hospitalizations down is not to get COVID-19. If you don't ever get COVID-19, you're not going to get hospitalized. So you really need to do everything in your power, which is staying at home if you're able to, washing your hands, wearing your mask, social distancing from other people. But, the hospital capacity is, like Dr. Burr said, it's high. It might not be at 15% today, but it has been the last couple of days. And that's very scary because, that's kind of the last thing that you see that starts getting really high. So it tells you there's a lot of cases in your community. And again, you really need to safeguard yourself and get vaccinated as soon as you're able to.
Right, and I think this would be a good time to remind everybody that based on the county's risk assessment level, we're in a code red right now in Nueces County for COVID risk. I have some things to add. So I ran the data again this morning, and we just put out an updated graphic on hospitalizations due to COVID on our social media accounts that shows that they're tracking the less optimistic model that we presented on Monday, and so hospitalizations are indeed increasing. Now, interestingly, right now, a lot of that's being made up by people in general admission hospital beds as opposed to ICU. And we're not sure if that will lead to an increase in ICU down the road, but at least right now, a lot of the increase over the past week has been due to general hospital admission due to COVID.
All right. So thank you all for taking the time today. Thank you very much, Director Rodriguez. I know you're very busy. And thank everybody for tuning in. The next task force report will be uploaded on Monday at 3 p.m. to social media. Please join us every Friday at noon for this question and answer session. And please remember to direct questions or comments at CBCovid on all your social media. Have a wonderful and safe weekend.
Thank you, everybody.
Thank you.